So the symptoms that one has depends on where the disease has affected that particular individual, and it can vary among, everybody has a different clinical picture. So for instance, one of the common presenting symptoms of MS is optic neuritis, which is usually a painful reduction in vision in one eye. And that's affected by inflammation or demyelination in the optic nerve, so the nerve that comes back from the eye.
The disease is called multiple sclerosis because there are multiple scars or areas of sclerosis. This leads to the primary symptoms of the disease.
So some of the common symptoms that we see in MS are things like loss of vision or reduction in vision in one eye, double vision, sensory symptoms, sometimes weakness, incoordination, imbalance, problems with walking, problems with bowel or bladder dysfunction, sometimes pain, and fatigue can be a big part of MS.
Most people with MS will only have a few of the primary symptoms during the course of the disease. Also, roughly 65 to 80% of people with MS are functioning, walking, and getting along fairly well 20 years after diagnosis.
So sometimes if there are residual neurologic symptoms, either a result of incomplete recovery from relapses or from progressive disease and progressive MS, it can make people more susceptible to certain medical complications. So an example of that would be an increased risk of bladder infections if the bladder isn't working properly.
It's important to educate yourself about MS and involve those around you.
Well, the best program in my mind is the MS Is program. It's a 6-week introduction to MS. One of the biggest reasons that I went to that course after my after my diagnosis. I went and took that course, and what happens there? You go and you meet other people, and basically, there's something. You all have something in common, although it may not be the same exact symptoms per se. You've got MS, and so you know what the other person. When you hear them talk about what they're going through, you can relate.
Well, sometimes I kind of wish that I always wish that he didn't have it, but I mean, it's not bad that he has MS, because his life wouldn't really be the same, I guess. I wouldn't be the person I was today if it wasn't for my dad.
Jody is my husband. I am so lucky to have him. When I was diagnosed with MS, he dubbed a saying for us that we're Team Williams and we'll get through this as a team and as together. And he says that MS stands for Mega Superstar, and I don't know how I would have got through this without him.
I think one of the concerns that people face when they're first diagnosed is disclosure, who to tell. And that can be a difficult issue. Most people do end up feeling comfortable enough to tell their immediate family, and I think that is important. It's a pretty hard thing to hide, and families tend to be pretty supportive in most cases. The MS Society has some booklets that help in terms of educating children about MS, but that's a concern. People often are worried about protecting their children. In the workplace, there's issues of disclosure as well, and I think that has to be individualized, and often it's in some workplaces it's best to disclose only on an as-needed basis. It's not something that can be taken back. Once it's out there, and some people, there is a perception in some workplaces, people don't have an understanding of what MS can mean, and it can be an issue of discrimination.
Tertiary symptoms are the social, psychological, or vocational problems that any chronic disease like MS may cause. Some of these include depression and anger, job loss or job change, and redefining personal relationships with friends, family, or spouse.
Often, if people are having a particular struggle with accepting the diagnosis or going beyond just the name that's been given to what they're experiencing, we'll have them see one of our psychologists who has an expertise in MS. And some people do need that extra help to kind of be able to cope with the emotional effects